One of the world's top vaccine experts based in Philadelphia says the latest advisory from the CDC will make America sicker again. Inside Story starts right now. Good morning, everyone. I'm Matt O'Donnell. It is Sunday, January 11, 2026. And thanks for joining us once again, as always, on Inside Story. The timing seems coincidental at worst. The moment when so many of us are sick with respiratory illnesses from the holidays gets injected with new vaccine guidance. The Centers for Disease Control, essentially led by longtime vaccine skeptic Robert F. Kennedy Jr., the head of the Department of Health and Human Services, reduced its recommendation for childhood immunizations. 11 vaccines now instead of 17. One of those no longer on the recommended list is for rotavirus, an infectious intestinal disease that poses the most danger to infants and young children. A Tufts University study found rotavirus caused 60,000 hospitalizations and 37 child deaths in the U.S. each year until a rotavirus vaccination program began about 20 years ago. The new guidance from the CDC, not based on any new data, has left the medical community dumbfounded, the conspiracy-minded anti-vax community emboldened, and parents of young children everywhere confused. The director of the Vaccine Education Center at Children's Hospital of Philadelphia, who is also the co-inventor of the rotavirus oral vaccine, is here to try and clear things up. Dr. Paul Offit joins us here on Inside Story, rejoining us from an earlier episode back during the pandemic. Welcome back, Dr. Offit.
Thank you. It's my pleasure.
So the 6 vaccines left off the CDC recommended list are now only recommended for children at high risk or after consulting with a health provider. Why'd they do this?
No idea. It doesn't make any sense. I mean, what problem are we trying to solve? Are we preventing too many diseases? Is that the problem? I think what Robert F. Kennedy Jr. believes falsely is that children are just getting too many vaccines, and that's somehow weakening or overwhelming or perturbing their immune systems and causing them to have chronic diseases for which there is no evidence. Quite the opposite. There's abundant evidence that's not true. I don't know why he's doing this. All it's going to do is make children sicker for no benefit.
Before we get to the nitty-gritty, Dr. Offit, let's just say I'm a parent with a newborn. I need to make some decisions about vaccinations and other health issues. What should I do?
Listen to your pediatrician. I think the pediatricians generally are ignoring the CDC, ignoring the Advisory Committee for Immunization Practices, and ignoring Health and Human Services, and looking to the American Academy of Pediatrics, which has the recommended schedule that was in place well before the anti-vaccine activist and science denialist Robert F. Kennedy Jr. took over as head of HHS. So I think your pediatrician can be trusted and generally looks to the American Academy of Pediatrics for advice, not HHS.
You are well informed as to what the anti-vax community says, and a lot of this stuff is just unfounded. It's not scientific, conspiracy-minded. But the one thing that I think might ring for everyone is the one thing that is repeatedly said, which is, why should I take medicine when I am not sick? So how does a vaccine proponent like you, looking to convince others that vaccines are safe and they are important, why should we take medicine when we're not sick?
Right. So vaccines prevent diseases. They don't treat diseases. And I think to some extent vaccines have been a victim of their own success. We don't see many of these diseases commonly, and so we think it's not going to be a problem. We kind of have this myth of invulnerability that's never going to happen to us. But I think if you look at some of these parent advocacy groups like Families Fighting Flu, Meningitis Angels, National Meningitis Association, these are parents who had chosen not to vaccinate their children and then watched their child suffer or die from a vaccine preventable disease, and then they take it upon themselves to try and convince other people not to make the same mistake that they made. But they all tell the same story. I can't believe this happened to me, until it happens to you. So your job as a parent is to put your child in the safest position possible, and vaccines provide that safety.
Denmark. It's been coming up a lot the last week or so. By the way, the CDC changes came without public comment or input from vaccine makers, and it seeks to model the U.S. vaccine schedule on 20 other countries, including the Scandinavian country of Denmark. That nation is one of the healthiest in the world, so the question, Dr. Offit, is why not model after a country that seems successful in caring for its citizens?
Right. So Denmark has a national health program. We don't. Everyone in Denmark can have ready access to the healthcare system. That's not true here. Denmark has a child poverty rate of about 4%. Our child poverty rate is 20%. Denmark has a much lower incidence of obesity, a much lower incidence of diabetes than we have. Denmark has child protective services much better than we have. Denmark is a homogeneous small country that has national health care. We're not Denmark. And for many reasons, we don't act like Denmark. And so take rotavirus, for example. That's a perfect example. So in Denmark last year, there were about 1,200 children hospitalized with severe dehydration, children less than two, because of rotavirus. Now, that country's 55 times smaller than we are. So if you multiply it out, it's roughly the same 60 or 70,000 hospitalizations we would have in this country. We chose to prevent that. We chose not to let children suffer. They didn't make that choice. So why? And if you talk to public health officials in Denmark, they all say the same thing. We didn't want to pay the money. So we did. We did consider child suffering and hospitalization worthy of prevention. Since we can prevent it, they didn't.
I want to ask you about a related topic here, the flu. There is a vaccine. It's not given to children, but it's an option for people to go, say, a pharmacy or whatever. This current flu season seems to be pretty bad. How does this change in the vaccine schedule relate to that, and how could it impact the current flu season?
Well, again, I want to argue that people should ignore what Robert F. Kennedy Jr. And his other political appointees behind closed doors are doing, because, as you note, it doesn't have there's no public comment, there's no expertise that's been provided to this committee. So ignore it. I think flu is a perfect example, just like rotavirus, just like SARS-CoV-2 or COVID vaccine. A flu, it's been a pretty bad year. We have 11 million cases of flu. We have about 120,000 hospitalizations from flu. We have about 5,000 deaths from flu. Last year, about 300 children died from influenza, and there's already been a handful of influenza deaths this year, meaning since January 1st. And so get your flu vaccine. I mean, although it is a tough year, the vaccine still is very effective at preventing severe disease. So get your flu vaccine. But again, I think that the way that it's now listed is it's so-called shared clinical decision making, meaning you can reasonably choose not to get a flu vaccine, as is your decision, but it's not a reasonable choice. You want to protect your child, vaccinate them against influenza.
The Secretary, Robert F. Kennedy Jr., you've spoken to him, not recently. It was back in 2003, and he was actually seeking scientific data on vaccines. Apparently he ignored it. What do you think his goals are here?
I think Robert F. Kennedy Jr. is of the belief that vaccines have simply lessened infectious disease at the price of causing chronic disease. And he is a warrior against chronic disease. And that war means doing everything he can to eliminate vaccines, to make them less available, less affordable, more feared. And in less than a year, he's been able to accomplish much of that. And the results of what he's done has become obvious. We've had a measles epidemic over this past year that was bigger than anything we've seen in 33 years. We've had 2 healthy little girls die of measles in this country when we haven't seen a child death in more than 20 years. We've had more than a dozen deaths from whooping cough, and we hadn't seen that in years. We've had now flu with 300 deaths in children, roughly, where we haven't seen numbers that big since the last flu pandemic. We've had, children who've had, and people who've had tetanus this year, more than anything we've seen in 10 years. This is what's happened. As you erode immunization rates, which is his goal, he believes he's doing good. That's why you never hear him do what he should do, which is use his considerable platform of being Secretary of Health and Human Services, his considerable platform of having his famous name, and get up there and say, vaccinate your children, protect your children. He'll never say that.
One more before you go. This is big picture, Dr. Offit. You can spend a lot of time on the internet and look into like the flat earth conspiracy theory, the moon landing, 5G, wireless networks. Why do you think this whole conspiracy theory about vaccines has gained so much traction, aside from who is running DHHS?
I think one thing Robert F. Kennedy Jr. said that was true is he said that he is a product of of the COVID pandemic. Meaning he has the job he has because of the COVID pandemic. And I think that's true. I think that in 2020, when we didn't have anything to try and stop the spread of a fatal virus that could be spread asymptomatically, we shuttered schools, we closed businesses, we restricted travel. And I think we shuttered schools too long. I think we closed businesses too long. And it was done in a very top-down dictatorial approach. Similarly, the following year, 2021, when we had a vaccine, you couldn't go to your favorite bar or restaurant or sporting event or place of worship. You may be fired from your job. And again, people saw that as sort of done in a dictatorial way without without public input. And I think we lean into this libertarian left hook, and I think we're feeling the result of that punch.
Dr. Paul Offit from the Children's Hospital of Philadelphia, vaccine researcher there. Thanks for joining us once again on Inside Story.
Thank you.